Plastic surgery procedure actually can make that happen, taking the frown right off your face.
Gail Anderson live in West Hollywood. All the details. Hi, Gail.
Yeah, we're not talking so much about getting rid of wrinkles with Dr. Richard Ellenbogen this morning. We're talking about changing the expression on your face. We want to show a sample before we show our live patient of the kind of thing that goes on. Now, here's a young lady here. Looks a little annoyed, would you not say, doctor? And then what did you do to her to take her from that to this?
Well, basically, I fixed her nose, but that didn't do it. But what I did do is I put a chin implant in. What the chin implant does, it's an operation which takes about 10 minutes. It's done from inside the mouth. It lifts up the corners of the mouth and changes her mouth posture, makes her look more pleasant. It's particularly used in women 40s and above, because what it does is it makes you look younger by changing your expression. It gives you a younger expression. I think a lot of women who get rid of wrinkles or try to work on their complexion are really missing the boat. I think the thing that really makes somebody look old is grumpy eyebrows or a grumpy mouth.
All right, now we have Twyla here, is that correct?
Exactly.
All right, now here's Twyla before. Looks a little annoyed. And then this is after your procedure. And then we have Twyla here this morning. Now, we looked at Krista earlier. You say this involved a little bit more work, this particular case.
Yeah, Twyla had to play a little catch-up ball. She had had some bad plastic surgery done, and what we had to do is we had to redo some things. Some of the grumpiness of her mouth and the expression, which looked older than she is, was related to old plastic surgery.
But in Twyla's case?
In Twyla's case, what we did is we fixed her eyebrows which were angry, by doing what's called a brow lift. There's a special way you can do this where you can actually move the hairline down, because what happens in women, as women get older, the hairline goes up and the face gets longer. Okay. So in other words, we actually moved her hairline down, as well as smoothing her forehead and lifting up her brows. The other things we did is to lift up the corners of her mouth with a chin implant. We also did fat grafting in her cheeks to create cheekbones and filling in different lines in the face or so. And the beauty
Doctor,
about fat grafting,
can you drop the hairline on men too? You know, if you because a lot of guys, not me, but a lot of guys have that hairline that goes up. Can you drop it?
I do it on men, but the problem with men is it's not stable. It's going to continue to go back, and a few years later they'll have an incision, and you'll be able to see it.
All right, before we run out of time, let me show you a little bit of tape here, because this also works for men when it comes to expressions. Now, we all know James Gandolfini, Sopranos, Tony Soprano looking real angry, and you also, so this, we know his expression, but doctor, you also have done this with men. Now, here's a gentleman, here's his expression before, and here he is after.
Yes, we did this with turning up the corners of the mouth, and we also did this by lifting up his eyebrows a little bit. Just making him look a little bit more pleasant, making him look less
All right,
less
and real
judgmental.
quick, let me show you one more bit of tape. Oh, I want to hide our patient. Take a look at this. Now, this is our patient before. Okay. And now here she is after, and it softens.
Yes, it softens her face. Many Latin women, as they age, tend to get a little angry looking in the brows. What we did is we lifted up her brows so she can wear makeup effectively or so, and changing the expression on her mouth and giving her a little fat grafting or so, and fixing the under the eyes. So the whole idea is to make her expression, her expression in repose, much more pleasant.
Expression in repose, pleasant. I like that. Here's how you can get more information about how to get your expression in repose a little bit more pleasant. Again, thank you, Dr. Ellenbogen, and thank you for coming out this morning and giving you some examples of some alternatives to making you look better. Expression surgery. Interesting.
All right, Gail, thanks very much for that.
Thanks, Gail.